So I'm going to call this meeting of the IP and Industry Subcommittee to order. Marianne, if you could call the roll, please.
Oh, sure. 1 second. Mohammed Abusalam.
Present.
Judy Chow.
Good.
Anne-Marie Dulage.
Yes.
Larry Goldstein.
Yep.
Steve Julesgaard.
Yes.
Jim Kovach.
Yes.
Shlomo Melmet. Joe Panetta.
Here.
Barry Selleck. Michael Stamos.
Here. I'll be on video in a moment.
Okay, no worries. Jonathan Thomas.
Here.
Art Torres. Carol Watson. Okay, we're at.
All right. Thank you. So we have a singular topic for today. This is actually a continuation of a discussion we had quite some time ago regarding for-profit companies and the issue of co-funding requirements for, in particular, at the time we were looking at translational projects. And the issue that we were seeing is that particularly for some of the very young companies, those that are still in the angel investing round or whatever, some of them were simply not able to come up with the amount of money needed for co-funding to be able to participate in the CERM programs. Again, we focused on the translational area. So if you'll recall, at that meeting, there was a desire on the part of this committee to see if we could come up with a structure that, in lieu of co-funding with money, we could come up with an alternate system in which a company would provide co-funding in the form of a warrants to purchase shares in the company that had the potential for having value should they be successful in their development down the road. So since that meeting, which again has been quite some time ago, we've done a fair amount of work looking at this issue. Barry and I, together with Sean Patel, who I'm going to turn this meeting over to in just a moment to walk us through the presentation, to try and come up with a recommendation for a warrant-based approach to co-funding as an alternative to coming up with money. So the proposal you're going to see would be one that, as I said, is an alternative. It would still remain the case that if a company could come up with co-funding in the term of cash, that would be acceptable. But the other would be if they're unable to do that or desire to try and do a warrant-based approach, then we would provide that opportunity for them. So with no further ado, then Sean, I'm going to turn the presentation over to you to take us through the slide deck that was sent out ahead of this meeting.
Thank you, Chairman Julesgaard. This is Sean Patel. I'm the Senior Director of Business Development and Alliance Management at CERM, and I'll be walking through a few slides describing the proposal that Steve outlined. So let me just share my screen real quick. All right, hope everybody can see that. Okay, so as Steve noted, earlier this year, this subcommittee had directed CERM to evaluate co-funding changes, particularly to a TRAN program, as well as specifically to look at a warrant alternative mechanism in lieu of the cash-based co-funding requirement. So I'm going to walk through, first of all, the current trends in the for-profit CERM awards, which is useful background for this committee. And I think there was some questions that were also brought up during that previous meeting. And then I'll talk about how we've historically implemented warrants in CERM awards. There's 2 instances of this, one where it actually was part of the program itself. And then lastly, I'll talk about the proposal for implementing a warrant-based co-funding option in TRAN, CLIN 1, and CLIN 2 programs, and give you a kind of an overview of what that might look like. And then finally, I'm going to lay out the steps should this committee want CERM to move forward with this program, how it would be implemented. So as a background to the whole conversation, it's important to recognize how we actually apply the co-funding requirement. So it is applied as a percentage of the total project cost. So if a applicant deems that a project cost is X amount of dollars, in that particular scenario, the co-funding amount is based on the addition of the CERM funds requested plus the award amount, the co-funding to a total project cost. So if we say it's a 20% co-funding requirement, it's not 20% of the CERM funds, but it's 20% of the overall total project costs. And this is important to remember as we walk through the example down the road in terms of how the warrants will be implemented, because it does come into play then, and I'll revisit this concept again. So with that out of the way, I also want to go over what the co-funding requirement looks like and the award amounts look like for the TRAN, CLIN1, and CLIN2 programs and how they differ based on the therapeutic modality being developed or the type of applicant. So on the translational side, again, the translational awards are meant to progress a project from having discovered a candidate to pre-IND meeting or a pre-IDE meeting if it's a device. So in these instances, the award amounts are scaled based on the type of candidate being developed, with the most amount of money for a therapeutic candidate at $4 million. These are direct project costs. In this instance, there are no differences in the award amounts between the nonprofit and for-profit for direct project costs. Now, the overhead costs are a little bit different. So for for-profit companies, they can request direct facilities costs, but can't request indirect costs, while a nonprofit can request both of those amounts. With the co-funding amount, there is no co-funding requirement for nonprofit applicants to the translational program, but there is a 20% total project costs co-funding requirement for for-profit applicants to the translational program. And then on the CLIN1 and CLIN2, here, the awards are total award caps. So for CLIN1, a for-profit applicant can request $4 million from CERM for that project, with the expectation that they're putting 20% co-funding of the overall total project costs. A nonprofit, on the other hand, can request $6 million and does not have a co-funding requirement. For CLIN2, the award amounts are different for first in human trial, but then the same for every subsequent trial. So for first in human trial, a for-profit can request $8 million from CERM for the total award amount and needs to put up 30% co-funding of the total project costs. For a nonprofit for a first in human trial, they can request $12 million from CERM with no co-funding requirement at all. Now, after that first in human trial, every subsequent trial is supported by CERM up to $15 million, and both the nonprofit and the for-profit have a 40% co-funding requirement at that point on the total project costs. So that's an overview of the two funding mechanisms, TRAN and CLIN, and this is going to be important as we walk through the examples down the road and how warrant-based co-funding option may be applied. And I'll revisit some of these numbers as we go through those. So at the time of application, this is one of the things that Steve mentioned. We do require that the applicant demonstrate that they have the ability to actually co-fund the project. So when they submit their application, there's two things we look for. The first and foremost is that they have cash on hand or committed co-funding without any sort of strings attached to it, equal to 25% of the total co-funding requirement. And the reason we look for that amount of money is that the expectation is that when the CERM award launches and CERM disperses that first amount for a milestone, that the applicant is also ready to disperse their amount. And as a reminder, all CERM awards are milestone-based disbursements, and I'll show you that in an example in a second. So the first requirement is that they have to have at least a quarter of the total co-funding commitment on hand when they apply. And the second requirement is that they can demonstrate they either have cash on hand or committed sources of co-funding for that remaining 75% of the co-funding amount. Now, this 75% of the co-funding amount will be dispersed over the course of the award. It could be 30 months for a TRAN award. It could be 24 months for a CLIN1 award, or it could be 4 years for a CLIN2 award. So there's a pretty long window of time where they need to show that they can demonstrate some of their funding amounts. Now, over the course of the award, as I mentioned, CERM as a milestone-based disbursement process for TRAN and CLIN awards. So at award launch, CERM provides enough funding to allow the grantee to get to that first milestone. And so the co-funding amount is also proportional to the CERM funding for each milestone. So at each milestone, CIRM is giving them money to achieve that milestone, and the applicant, the awardee is also putting up the respective co-funding proportion for that milestone achievement. So a question that we've gotten from this committee in the past has been, how many for-profit awardees are there, and how are those numbers changing, and what is the profile of those for-profit awardees? So I'm going to address some of those questions in this slide here. So first and foremost, what I'm doing here is I'm splitting the proportion based on pre-2021. So you can think of that as Prop 71 funding, and then January 2021 and beyond, we can think of that as Prop 14 funding. So under the Prop 71 era in the CLIN program, this is aggregating both CLIN 1 IND enabling projects as well as CLIN 2 clinical trial projects. Roughly 40% of the awardees were for-profit. And in the course of Prop 14 funding, there was a dip in 2021, but in 2022, we're back to that almost parity between for-profit and nonprofit awardees for our CLIN program. And this is what we expect to see going forward. On the translational side, prior to 2021, now one thing to note here is that the TRAN program had a few starts and stops along the way during the Prop 71 era. But under the Prop 71 era, there's about 12% of the awardees were for-profit awardees for translational awards. In the Prop 14 era, both in 2021 and continuing in 2022, there's been a significantly higher proportion of for-profit awardees in the translational program. And we continue to see that volume of applications and awards every round, and we expect that to carry forward as well. An important question from this committee has been, what are the types of companies that actually get CIRM funding? So on the translational side, the companies are, as Steve described, very early stage. They're either seed. By seed, we mean they either have grant funding or they have initial seed funding from angels or maybe a VC, venture capitalist, through venture Series A, B, and usually it's Series A. So these are fairly early stage companies, and they're operating off of a limited amount of cash and resources, and every program is critical for them. On the clinical side, we see the full range from seed through public. So there's seed finance companies all the way through public. The public companies are usually pre-revenue, and they're small to mid-cap companies. And so they're not giant biopharma companies applying for CIRM funding in most instances. So with that in mind, the rest of the slides are going to focus on the warrant-based co-funding option. So as I mentioned, there's been 2 instances previously where there was some sort of loan coverage in CIRM funding opportunities. Most recently, it was the Accelerating Therapeutics Public-Private Partnership Program, which did not award any applications, but that had warrant coverage as part of the award. And more prominently, there was a loan program in the past that CIRM had run for a number of years that did have warrant coverage. So in lieu of getting an award, an applicant could request to get a loan instead from CIRM that it would pay back on certain terms. And as part of that, there was warrant coverage, and that warrant coverage often was substantial. There had been some changes in the loan program over time, but the warrant coverage could be as high as 100% of the loan in some instances. That loan program also defined the warrant terms with respect to term length, number of shares, exercise price, and so on. And lastly, it also established a process for assigning warrants to a third party, liquidating those shares, then transferring those funds to CIRM for redeployment under its funding mechanisms. And so the warrant option that I'm going to be walking you through in the rest of this proposal borrows and adapts and adopts a lot of the elements that were previously defined in that loan program, particularly around the process of assigning warrants and transferring funds, but also some of the warrant terms where they are useful for CIRM. And I'll walk you through those in the remaining slides. So the proposal itself, what do we mean? So here, one thing I want to make clear is that the warrant-based co-funding option that we're presenting in the next few slides does not make any changes to the award amounts or to the co-funding requirement itself. So it's applying a warrant-based co-funding option given in the current confines of the TRAN and CLIN funding mechanism as it is, without making any changes to those. So with that in mind, it provides an option to the applicant to select the warrant-based co-funding option. And to avoid confusion, I'm going to refer to the original co-funding requirement as the cash-based co-funding requirement. Here, the company's actually putting up capital to fund the project along with CIRM. Under a warrant-based co-funding option, the company is not putting up capital for the minimum co-funding amount, but will if it's an award bigger than that. And I'll walk through that as well in a second. So when they select the warrant-based co-funding option at the stage of the application submission, what they're agreeing to is to issue warrants to CIRM in value equal to the minimum total project cost co-funding requirement. And the applicant in return may request CIRM funding up to the award maximum. And the reason for this is because the co-funding amount is based on the total project costs. So if we were simply to say, you can issue as warrants in lieu of putting up cash, there would still be a funding gap for that program, which needs to be filled. And that's kind of why we're saying this last point where CIRM funding has to cover up to the award maximum. And it's very difficult to describe that in words. And the best way to do that is with an example. So I'm going to walk you through that now in our Tran 1 application scenario. And this will make it clear as to what we mean between the cash-based co-funding option and the warrant-based co-funding option, which preserves the overall funding of the project itself. So here we have a table. Let's focus on the left side here with the orange column. So I'm going to take two examples. The first is a $4 million project, Tran 1 project. So this is basically, it's going to cost $4 million to go from having declared a candidate to having conducted the pre-IND meeting. In this particular scenario, under the current Tran program, an applicant can request $3.2 million from CIRM with the expectation that it's putting up $800,000 of its own co-funding to cover that $4 million total project cost. So now, if we were to apply a warrant-based co-funding mechanism to this and not account for the $800,000 coming from the company, then there would be a gap in the project funding. So to avoid that, what the warrant-based co-funding option provides is that the CIRM award would be $4 million. So the applicant could request $4 million from CIRM, which is the cap at the moment. They would not be putting up any cash co-funding in this scenario because the minimum co-funding amount is covered by the additional CIRM funding. And then in return, they would be issuing to CIRM warrants that amount to $800,000 in co-funding. So essentially, what they're getting is a $4 million award to cover the $4 million direct project costs of the project in return for providing $800 million in warrant coverage to CIRM. And that preserves the overall funding amount for that project. And it also allows the company to commit equity instead of capital to the project. Now, this scenario is important to point out that under the current confines of the funding mechanism and the co-funding, the way the co-funding is applied, is relevant and useful for a subset of awards. So if we take another example here, let's say it's a Tran 1 project that's actually going to cost $5 million. So it's going to take $5 million to take a therapeutic candidate from discovery stage through a pre-IND meeting. In that instance, the applicant can request $4 million from CIRM, and it could meet its 20% co-funding requirement by having $1 million of its own money put up, which it's going to need to do because it has a $5 million project that it's proposing. In that instance, the CIRM funding plus the applicant's co-funding amount to cover the total project cost. And in this scenario, a warrant-based co-funding option would not be useful and would not be attractive to the applicant because the fact that they've already reached the cap of the CIRM award and they cannot request any additional funding from CIRM to cover the co-funding cash that it would be putting up in lieu of instead of putting up cash giving as warrants. So in that particular instance, it does not make sense for the applicant to take the warrant-based co-funding option. So the long-winded way of saying that there are a number of projects where the award may not have hit the award cap, and it could request additional funding from CIRM and instead of putting up its cash-based co-funding, it would get warrants in return. It would provide warrants in return. So to put that into context of the current state of awards that we've been giving out, how many applicants are actually hitting the max and how many are not. It's important to understand how many warrants we may actually be looking at down the road. And again, this is all within the confines of the current awards. We don't know what would change with this warrant-based co-funding option, what sort of companies would come in, what sort of projects would come in. But if we were to apply this historically, what would happen? So for TRAN, again, the direct project award max is $4 million. The average CERM award is $3.8 million. And 3 of those 8 companies that we counted in this particular scenario had reached the award max or were near it. And the cutoff I used here was $50,000. So I said if they were at or within 50K of the award max, and how many were not. Just to give you an idea as to how many were maxing out and how many were not. And this is a heavily filtered table here because trying to keep consistency with respect to award amounts, award caps, and timing and so on. So it doesn't represent the entirety of TRAN awards that have gone out to for-profit companies. On the CLIN 1 and CLIN 2 side, what you see is that on CLIN 1, the average award has been $3.8 million. Again, the cap is $4 million. And roughly 4 out of the 5 programs that are counted in this particular scenario were within 50K of the max amount. On the CLIN 2 side, you have a lot more variability. Here, the average award size is $6.3 million, and only 2 of the 11 companies were at or near the max for their particular award size. So to recap, the warrant-based co-funding option would allow the company to not have to put up its cash for the minimum co-funding requirement if there is room for the CERM in the CERM award to cover that amount. If there isn't, then it does not really make sense for the applicant to actually exercise a warrant-based co-funding option. So just want to go over what the impact of this option would be on CERM, the applicant, and the project. So the impact of CERM, first and foremost, it enhances our ability to support emerging companies and to expand our portfolio. So as Steve mentioned, the original intent was to be able to support companies that may not have been able to meet the co-funding requirement when they apply to CERM, and this would allow them to do so. It would also allow other companies who may want to preserve some of their capital to maintain company operations and put up equity instead of their capital at that really early stage to take advantage of CERM funding opportunities. It would increase our award sizes, as I mentioned, because we wouldn't, in essence, be covering some or most of the co-funding amount that would be coming from the awardee in return for warrants. The warrants would provide CERM the potential for financial return, but it's important to note that there's also the risk of zero future value. And lastly, it would increase administrative effort and legal costs for CERM. So administrative effort in terms of establishing the agreement, managing the warrant portfolio. On the legal cost side, this would be in terms of coming up with a model agreement, as well as any future amendments that may need to be made to that agreement that might require legal review. So the impact of the applicant awardee is also relatively straightforward. First of all, it enables access to CERM funding opportunities for companies that originally could not meet the co-funding requirement. It also allows for demonstration of financial commitment to CERM funded project without having to put up its capital. And it's important to note that we designed this proposal to have no adverse financial impact on the project itself, which is of foremost important to CERM, which is to advance these projects and to bring these therapies to patients. So the awardee's cash commitment would be covered by CERM award up to the award max in the example that I tried to lay out in the previous slide. So how would we implement this? So I'm going to talk about first the process of how we may implement it and where we may allow for some sort of cancellation or amendment. And then I'll walk through some of the terms that we think are relevant and informative for this proposal. So first and foremost, as I mentioned, the applicant would have to select a warrant-based co-funding option at the time of application submission. They would have a CERM model warrant agreement to refer to, which will lay out the terms, particularly around the share price, the term length, and the number of shares, and I'll discuss that in the next slide, but also some other terms around automatic actions or cashless exercise and so on. During the award contracting phase, so this is after the application has gone through grants working group review and has been approved by the ICOC. This is when CIRM and the awardee are negotiating on the award. We would execute the agreement at this point so that it would issue all the warrants at award start date. So at the start date of the award, when CIRM commits its first milestone-based disbursement, at that point, the awardee is issuing all the warrants. And the reason for this is because CIRM is actually putting up and committing the entirety of the award amount at risk to CIRM for that award and that project. And in return, the applicant needs to be able to provide those warrant coverage to CIRM. So in terms of warrant cancellation, there are two scenarios that we're evaluating. First and foremost is during the course of the award. What if there are scenarios where either during contracting or during the award phase itself, the awardee may want to revert to the cash-based co-funding requirement for any reason? And this is possible. We could simply cancel the warrants in that case, revert back to a cash-based co-funding requirement with the expectation that now the awardee is going to commit and disperse the minimum co-funding requirement. And since we require that co-funding be dispersed at every milestone, this provides CIRM the appropriate protection. And it also allows for return of funds if all those funds have been dispersed and the applicant wants and the awardee wants to revert back to the cash-based co-funding requirement over the course of the award. So we believe it's relatively straightforward during the active award. Now, post-award, we right now in our clinical program have a loan conversion option. So loan conversion option allows any awardee after the award has ended to convert their grant to a loan and to pay it back with principal and interest. And that would extinguish the revenue sharing requirement. And the reason that exists is that to ensure that the CIRM award is not a barrier to further development of that candidate or commercialization of that candidate when it comes to partnering activity and so on. And so we are evaluating whether a similar option could be feasible to cancel the warrants by some sort of a payback mechanism. And because of the nature of the warrants and the time and the expiration and so on, we need to look at this more carefully. And so what we would do is evaluate the feasibility of implementing such an option prior to ICOC review of the concept plan changes and come back to you should this committee allow us to continue forward with developing this program. And then when we come back to you for review of the overall program. So I'm going to quickly go over some of the warrant terms. Again, these are subject to change as we develop this program, should the committee approve for further development. But I wanted to lay out some basic terms. And these borrow from the previous loan program and are almost identical to the way the warrant coverage was implemented in that loan program. So the warrant term length would be 10 years. If we set at that, would be non-negotiable. The exercise price would differ based on whether the company is a public company or a private company. So for a public company, it's relatively straightforward. We would use the average closing share price of the past 10 trading days. This is for common shares. And then for the private company, the exercise price would be set at the preferred share price in the most recent financing round. Now, in some instances, if these companies are very early, they may not have had a financing round. They may have various other investments that are also floating until a financing event has been set. And so in those instances, we would float until a financing event sets preferred share value. So for example, a Series A round would set a preferred share price, and then that would then set the exercise price for those set of warrants that CIRM has. And the amount of shares, so this is a little confusing, but I'll walk you through this. So it'll be the dollar amount of CIRM award corresponding to the required minimum cash co-funding. So in that previous example, where we'd indicated that if it's a $4 million direct project cost, and the awardee, instead of getting a $3.2 million award, could get a $4 million award and have to provide $800,000 in coverage to CERM, this is where that calculation would come into play. So we take the $800,000, divide by the exercise price, and that would determine the number of shares that the warrants would have to issue to CERM. And lastly, we'd want the model agreement to define other terms that are important to CERM and how it may transfer, sell, or assign the warrants to a third party, how it may be able to exercise a cashless exercise option. So instead of paying for the actual shares, to incorporate the cost of that and reduce the share amount appropriately. To make adjustments in the event of company changes to company equity. These are fairly standard terms that are in most warrant agreements. And then lastly, any notices, rules, and automated actions governing mergers, change in control, liquidation, and so on. And these will be very important for CERM as we manage a portfolio of these warrants, and want to make sure that there are certain triggers that we take into account that would allow for the transfer of the warrants, the sale of the shares, and liquidation of funds back to CERM. So lastly, I want to cover what the process will be. So first of all, if the plan is approved for further development today by the subcommittee, this would trigger the following steps. We would go back and develop the concept plan changes, as well as create a draft model warrant agreement as a reference. And in the first quarter of 2023, we would hold a joint subcommittee between the Science Subcommittee and the IP Industry Subcommittee to review the TRAN, CLIN 1, and CLIN 2 concept plan changes. If those committees approve those concept plan changes, we would take it to the next ICOC meeting for concept plan changes to TRAN, CLIN 1, and CLIN 2 programs. Again, we would provide the model warrant agreement as reference. After the concept plan changes have been approved, CERM would implement those changes in the PAs, in the applications, and the notice of awards. And at that point, the program would be live. And we think that would take maybe a month or two after the ICOC approval. So it could be a relatively quick timeline to get the warrant program implemented in TRAN, CLIN 1, and CLIN 2, assuming that we work out the draft model warrant agreement terms, as well as make the appropriate concept plan changes. So with that, I'm happy to take any questions, and I'll hand it back to Chairman Julesgaard.
Thank you, Sham. Thank you for that very detailed presentation. So as Sham said, let's see if there are any questions or comments that any of the committee members might have.
We have a few, Steve. I see Mohammed.
Yeah, so we'll start with Mohammed and then Larry and Joe.
Great.
Good morning, everyone. And thank you, Sham, for this very clear and creative and thoughtful model and presentation. And just for everyone, just to clarify, this is my first time on the committee, so I don't have the history of the conversations that took place before, but I do have a few comments, and they're coming from generally a position of concern as opposed to, you know, full support yet. So the concern that I have a few to put together. One is I don't agree that the impact on the application of ORD is demonstrating financial commitment, because really demonstrating financial commitment is by putting up cash. If you're putting up warrants, we all know that early young companies, very easy, relatively anyway, for them to write warrants or give out stock because they don't have cash on hand. So I would not make the statement that this is a demonstration of commitment. And then the impact on the CERM-funded project, if I understood you correctly, Sham, there is, you say there's no financial impact. I think there is, if you took the example of a $5 million project, if there is a cap of 4 million and they don't have the cash to do the 1 million, then they're limiting the whole project to the 4 million by going this route, and they will not have enough cash or will not get cash from CERM to pay for the additional direct costs that are needed. I might have misunderstood the cap, but I'm just saying I don't think we can just say no impact on the project, because it does limit their ability to do bigger and things. So let me come to the salient point, which is part of what CIRM is doing is you're supporting the technology and you want the invention to come out and come through. But part of that, a big part of that is the viability of the business that is carrying that invention and that discovery and that project through. So part of our assessment of these companies is going to have to be their viability and ability to continue on their path. So our money is going into a project that's going to actually live through that experiment. And a company having cash, even if it's a young company, having cash from angel investors or other early investors, even if it's friends and family, is a demonstration of their viability and attractiveness to the financial market. Yes, it's early, but that element is important. And by not allowing them to actually do their work and get money to support their plans, we're taking the pressure off management, and we're actually not helping them learn how to bring money in. So there's this piece of the ecosystem that we're trying to develop around the science that we're supporting. So to me, there's not enough skin in the game from the company using, they're really using full money to the fullest, free money to the fullest. My recommendation, I like the concept, but my recommendation is we balanced out that model with some elements that still preserve that actual skin in the game, actual money paid, as opposed to just giving them the, essentially the free money. And I say free because early in the company's age, the value of their stock is not very high. So just keep that in mind. Thank you.
Shab, do you want to respond to that?
Thank you. So I'll respond to the point around the $5 million example that I had given out. So in that instance, what I was arguing was that if it's a project that does not have the ability to replace its cash-based co-funding commitment with additional CIRM funding up to the award max, in those instances, that particular applicant would not actually select a warrant-based co-funding option. They would still be committed to the cash-based co-funding option because they would still have to put up that money to get to the total project cost. So it would just not be a useful option for them. They would still be putting up the cash co-funding. So in this scenario, there are always going to be applicants who are just selecting the cash-based co-funding option because the project cost is just beyond what CIRM award can fund, even with the max amount available. To your other points, I think with respect to the financial commitment, that's a good point, that providing capital as opposed to providing warrants is not equivalent, and I appreciate that. From my perspective, with respect to the companies and how they're financed and raised and operated, I always look at this as if it's a really early company that has a CLIN 1 or a CLIN 2 award and that committing money to that project, even if they're not committing money, they're committing significant resources and personnel to it, and there's huge opportunity costs for that, as opposed to any other project they may have in their pipeline. And so there's always going to be that resource commitment they're putting up, even if there isn't a direct financial commitment. And I absolutely appreciate your point that you made with respect to, the companies should be bringing in more money than just CIRM funding for sustainability long term. So I appreciate that.
Larry?
Yes, thank you. I want to give the same disclaimer as Mohammed. I'm new to this, and so I may be asking us to tread through ground we've already done in the past, but I'll move ahead anyway. So first is a variant of Mohammed's question, which is in cases where we would be doing warrants in lieu of cash, would the review of the project include a business review so that in addition to evaluating the scientific or clinical potential, we're also evaluating the business viability of the proposed project or company? And I guess I'm hearkening back a little bit to the orchard situation where a therapy was developed that was ultimately, clear it was not economically viable for the company and probably should have stayed in academia all along. So I'll distill the question. Would the review include a business review?
Sean, you want to respond to that?
Sure. So our current applications don't have a business plan section. So you may be familiar, there are other, for example, SBIR and other NIH-based mechanisms do have a business plan section that applicants review, that fill out, and then the grants working group members review. We don't have that in our applications. In this particular instance, to the point that both you and Mohammed made, if it's important that there be a review of their business plan that describes how the company is going to progress this project as well as maintaining sustainability, that would be something we definitely would consider.
So Sean, just let me add, so no matter what amount of money a company is requesting, this is the early part of your presentation, they have to demonstrate that they can basically provide their part of the commitment, right, of the money, that they have the wherewithal to proceed with the project. I mean, it's not like we don't have any business review at all. We do have one. And so I think it'd be, maybe we have to enhance it a little bit, but I mean, I agree. I think we need to make sure that they have the wherewithal to be able to do what it is that they're proposing to do, and not just, in essence, free riding on the money that we would provide. Having said that, I just want people to keep in mind that the overhead costs that we're providing are substantially less in the case of a for-profit company than in the case of a non-for-profit organization. So they're having to bear a bigger burden in terms of those kind of costs than nonprofit companies are when they sign on to a CERM award. Joe?
Excuse me, Steve. I have one or two other questions, if I might take advantage of the time. I'm sorry.
Yeah.
I guess my second question is, should we be more aggressive as an agency and take the view that we always want to take shares in a company as opposed to co-funding, so that we always share in the growth potential of these young companies? Some of them will, of course, hit. Most of them won't. But we could, by providing early stage funding, we're effectively acting like a VC in some way. And maybe we should consider always taking that view so that we always share in growth.
So let me ask you, Larry, why wouldn't we do the same then for academic settings? Why wouldn't we ask for that sort of return as well there? Why do you distinguish companies from nonprofit organizations if you're looking for economic return?
Well, I think it's just a fundamentally different situation, Steve. When we're dealing with academia, we know that nobody's going to get a profit from it, and the reward will be the development of a therapy. But when we participate in the private market, where there is the potential of financial reward for all of the projects, why wouldn't we want to share in that growth potential of that market?
Well, to speak to the first point you made, I just would point out CERM and the company 47. I mean, Stanford and the company 47 that came out of Stanford, and the tremendous amount of money that Stanford made, particularly when that company was sold to Gilead. There was a substantial economic return to Stanford in that circumstance. Now, the good news is that we had a deal in that case. Our regulations provided that we got a return from Stanford, which amounted to a little over $15 million, as I recall, that we got from Stanford. So the institutions are not necessarily that much, some of them anyway, not much different than for-profit entities. Anyway, do you have another question, Larry?
Finally, if we take the view that we want to share in the growth potential, do we really want to allow a company to buy back its requirement of financial return to CERM? So, as you've diagrammed it, a company could buy back their warrants at a time when they think that their value is just about to skyrocket. so that they don't have to pay what is likely to be the anticipated return. Again, my point of view here is that in dealing with these for-profit companies, should we think about acting more as a VC than an academic organization?
Hi, it's Jim Kovach. Yeah, that's the thing that jumped out at me, Larry. Thanks for pointing it out. Is inevitably the company that is going to succeed would buy back the warrants, and we lose the opportunity. So I think it's a little different than the loan. So thanks for those three really good comments.
So Joe, you were next.
Thanks, Steve. I think it's a great discussion, and Ken, I think generally I'm in support of the approach, and I'm maybe a little bit more empathetic to this, having gotten my start in biotech in an early stage company that struggled to be able to move products through research and commercialization, and worked hard at it, regardless of where the funding came from. So, as I think about this in my time on the board, one thing that I've always looked forward to has been the potential for the progression of science to move from academia and into the hands of industry partners who could potentially develop it to commercialize products and to ultimately get those products into the hands of doctors so that patients could be treated. And that's really what our goal is here, right? So we want to see success, and we want to see success in a way that we're always going to take some risk to be able to enhance the opportunity for success. We've always taken that risk, and we want to see the technology move forward. We don't necessarily want to make a profit on it. We don't necessarily want to make a profit on the companies that are developing the technology. But I think, from my perspective, that I want to do everything possible as a member of the ICOC to enhance the opportunity and the ability for companies that demonstrate, and we've got a very rigorous process, demonstrate their ability to conduct clinical trials and to move products through translational phase, to be able to do that. So I think we are very selective when we make the decisions to give funding to these companies. I think, to Steve's point, we do look at it somewhat from a business standpoint as well. But I think it's a risk that's worth taking. I appreciate the concern that maybe it might appear as though the company doesn't have skin in the game by issuing options. But I, again, look at it more from my experience that there's a lot of incentive to move successfully through research and development with a company that goes beyond the idea that they're getting free money. Ultimately, the goal of the company is to be successful and develop a product. And I would hope that the companies that were providing this option to demonstrate that commitment in their application and in the way we look at them as well.
Thanks. Michael, did you have additional comments?
Yeah, I do. Thank you. First of all, I really appreciate the conversation. I think a lot of good points have been raised, and I won't reiterate them other than to say one of my big concerns was the cancellation policy. I think it, in many ways, unfairly advantages and disadvantages CIRM, advantages the company, disadvantages CIRM in terms of our ROI. What I was going to go with is we have a history of giving warrants instead of cash. It sounds like, based on what I saw on the presentation. What is our track record? How have those companies done compared to those that put up cash in terms of success? Because at the end of the day, that's what we care about, is success of any of these, right? Because the idea can be the greatest idea in the world, but if it doesn't reach success, as evidenced by commercialization in this case, then it doesn't really matter how good of an idea it was.
Well, you have to remember that, and I'm going to get to Jim in a minute, that no matter what, in all of these, there's a second bite of the apple, so to speak, and or even first bite of the apple, and that's the royalty arrangements that we have with both for-profit and nonprofit organizations. That royalty is based upon the amount of funding that we provide. But if there's a commercial success, no matter where it happens down the road, whether it's with the original organization, whether it be an academic center or be a for-profit company, or somebody that follows on from them, CIRM gets a royalty on commercial sales of a product. So there's always that lies in the background. And what kind of raised this is that as Sean was pointing out early on in the presentation, what we're seeing is a migration. In the early days of CIRM, almost all of this stuff was being done in academic centers and not so much by companies. And now we've seen a migration where the companies are basically really getting involved in the areas that we are important to us. And the thing that we faced is, in some cases, companies simply weren't able to apply for grants because they couldn't meet the financial hurdle of providing the amount of co-funding that we wanted. So this is what Joe is relating to. I mean, we have two missions, but our first and foremost mission is to try and bring new therapies to the front so that we can, deal with these unmet medical needs. And so part of this was a way of enhancing for-profit companies to be able to do that, particularly when they're financially strapped. So in any event, this is, I think, kind of what's at the center of this is really trying to make sure that we cast as wide a net as we can for providing for the opportunity for new therapies to be developed without hamstringing organizations, unlike academic centers that may not have the wherewithal to be able to support these projects. Jim, I know you have your hand raised, and then Mohammed, back to you.
Yeah, I want to say Mohammed kicked off a really interesting conversation and a really good one. And like Joe, I had worked in biotech before, and I feel like, the companies giving up issuing warrants generally are, they value their company and their own work very, very highly. And so I do think that there's a lot of value there. In fact, it seems to me that as a warrant holder, it would usher in kind of this kind of continuation of the changing of CIRM to really kind of be interacting with companies in a different way. I mean, if you look at it just kind of theoretically, depending on the early stage of the company, CIRM could be a very considerable shareholder or warrant holder, right? They could actually have a significant place on the cap chart, and so that's just different than that has been in the past. And just wanted to point that out, that there'd be probably need to continue to kind of this movement towards more of an analysis of the business plan. And I know we do that already, but it really would seem like it would kind of usher in a new era in a way to CIRM. So and I think I like definitely like the kind of innovative thought behind the proposal.
Thank you, Mohammed, and then JT.
Thank you, Stephen. Thank you, everyone. This is a very good conversation. I'd like to revisit a couple of points. The point of a business review, for example, and I like the concept, could at least be the viability, again, the company's ability to actually carry out the project. I know we do that with the programs, but in this case, if we're funding it 100%, how able are they to actually carry out that project and continue beyond, as opposed to drop dead right after? That's really the point that we have to look into. I think one of the points that was made, and I just want to clarify that because that's my understanding and that's my vision. CIRM should not shy away from taking its share of the profits from these companies. And in my opinion, there's nothing wrong in saying this is one of our goals, because we want this money to go into funding the deployment of these solutions into the underserved communities. So we do have a financial goal. And if this becomes a vehicle for that, then great, this is a good opportunity to do that. And back to, and I forgot who mentioned this, it could be Michael, I'm not sure, but what about the cancel? Then we may want to change the terms. And in a case like this, the company does not have the option to cancel the warrant, but it's only at the discretion of CERM. And that could balance out this. If we see that this company is going to grow and become successful, and we can actually want to support them further, but also get a share of that success, let us make that decision that, yeah, we want to continue, we don't want to get out, or we say, let's cash out now and we're done. So you may want to consider that just to achieve that balance between our ability to share the revenues for the other causes, and also support the company at the time when they're really in tight situation. Thank you.
JT?
So I'm going to go back to one of Larry's suggestions, and Steve asked to clarification on your response to that. So his suggestion about requiring that we get warrants in basically every case, and your question about would that apply to academia also? So might there be an approach here where obviously the whole reason that the 47 Inc. panned out was there was a spin out, and it did its couple rounds of financing and ended up getting purchased, and that spawned the money that we got out of it as a share of what Stanford made. Is there a potential play here to require of academic award recipients that they impose upon any spin out that might arise from what we've funded a warrant obligation that we can take advantage of down the road? So Steve, that's a question to you. Is that what the sort of thing you were thinking about potentially?
Well, so let's just revisit history. So the reason that we got this amount of money from Stanford was that under our old regulations, essentially when they out-licensed, we got a percentage of the of what they received in that out-licensing situation. And those were our old regulations that were imposed on every academic institution going back in time. And Ben can help remind me if I go astray here. We subsequently changed all that. We decided we're not going to impose those kinds of constraints on anybody and simply rely on royalties upon commercial success. And so any milestone payments or licensing payments, et cetera, that were received by anybody no longer were considered as part of an income stream to CERM, but rather we, as I indicated earlier, have now reverted to simply a royalty on product success. So the warrants are a little bit like the way we treated academic institutions in the past, which is that if there was, success in terms of their out licensing, then they owed us some portion of that out licensing success. And I don't have an issue with warrants for for-profit companies necessarily. We are treating them different than academic institutions, but I would point out that there is that distinction, and I raise Stanford because as an example, because that was a tremendously successful circumstance for them economically. They made really a significant amount of money out of the ultimate acquisition of Gilead of 47. Stanford held those shares up until the Gilead acquisition. So, it isn't always the for-profit companies that are, coming away with major economic returns. And it certainly can be the case in the academic setting as well.
If that same scenario occurred today under our current rules with Stanford and Gilead, would we get a royalty on that?
We would get a royalty on the Gilead, and we do today. If Gilead gets an approval of the anti-CD47 antibody, they haven't yet, they're still in clinical trials, but if they get an approval and they start selling that antibody, the one that was developed under the CERM research that was done, then yes, we'll get I don't know what's a, yep. Ben, I know you're on the line here, correct me if I'm wrong, but I think it's a 3% royalty, something like that.
It's a little different. the royalty formula back then applied to for-profits, and for nonprofits, we took a percentage of the licensing revenue. So for this, for example, so if Gilead does commercialize a product, in this case, we're taking a percentage of whatever Stanford receives.
Okay.
Under our current regime, for example, let's say if it was awarded under our current regs,
Right.
we would take a percentage of the net commercial revenue that Gilead has. So instead of taking it from Stanford, we would go ultimately to the commercializing entity. So that's the distinction.
That's helpful. And I may have missed this, I apologize, but we're all data driven. Do we have a track record of our own funding in terms of warrants versus cash? Has success rates of those companies? I still think that would be helpful to know if we have that data.
We have, I mean, maybe Sham could also interject, but we've had so few instances of the warrants, and I actually, in one of those cases, the entity who went that route actually paid it all back within 2 months with interest. So we did still keep the warrants, and we exercised a number of those, but there's not really, enough data points, I'd say, to have a real track record.
Okay, thank you.
Yeah, I would just make the point that it was tied to that loan program. So it's never been done under the current programmatic based funding that we have under Discovery, Tran, and Clin. That previous loan program, there were, I think, about 5 loans given out, and because of some of the terms, it wasn't a very popular program, and that's why it was stopped. But there was one instance where warrants were issued to CIRM, and then they ended up being transferred to a third party, exercised, and the funding came back to CIRM. So it was not like a great example that we have there. We can't really directly compare it to what we have now. But in terms of our current funding opportunities, the companies have gone on to have various types of partnering opportunities. A lot of them have raised venture capital after getting CIRM funding. Several of them have been acquired, and a few of them have gone public.
I think the thing of it is that, Sham, how many products have evolved into the commercial setting that CIRM has provided funding for? How many are there?
So how many of them have gotten approval, or how many?
Yeah. How many are being marketed right now that at some point along the way got CIRM funding?
I think that's a question.
47, but that product is still being developed by Gilead.
That's right. So Maria, do you want to answer that question? You might have more of an insight on that than I do.
In terms of total programs that have ever touched CIRM funding, there are quite a few. There are just very few. There are actually cancer programs, there's small molecule programs for cancer, and they were programs that were funded, kind of an early stage development. The programs that have been going through the current model of this therapeutic development, I would say pipeline development, we have none that have been that are currently marketed. So I wanted to just also, I think this conversation is great. I wanted to bring back the original reason that we felt that this is something that was worthwhile looking at, is that in the current climate, we know that both academic and for-profit or for industry applicants to CIRM may not even come in at all. So, and they may have very promising approaches with strong science behind it. So the whole idea is, how could we even have a threshold that would allow us to de-risk meaningful programs that serve the mission? So I just wanted to bring that to the forefront. We have been seeing that even our own programs that were gaining some early clinical, promising clinical data, we're having problems even from the academic side that just recently spun out to get the co-funding in order to even come in for CIRM funding. So there were a couple of different inquiries to us in terms of what can they do in order to continue development of those programs.
All right, Judy, I see your hand raised, and then Mohammed after you.
Yeah, I want to build further on what Maria just made a comment. I really don't have strong opinion on the warrant one way or the other, but just thinking about the funding for academia versus the industry, I think nature got to be the stage also among, in a sense, if you really want to act like a VC to promote in the business world, I think the milestone funding is very important. However, in my opinion, I think for academia, it's a little bit different because you want to give as much as possible to allow different idea can be reiterated and finally come to maturity. But for industry, I think in the business setting, I mean, good or bad, I'm in industry, so everything got to have a business reason, right? So then I think a milestone driven of the funding is probably, I think that topic is even more important. And how do we look at the warrant and all down the line? It's more about then how do we set the stage, the milestone hitting certain point to allow even more funding to encourage the innovation, because there's got to have the nature kind of the nature of the business world to select the one truly have the value and survive.
Well, and I that's sort of how we do things now. So the funding under any program is based on meeting milestones. And if you don't meet a milestone, then you don't get the funding. So we already incorporate that idea into how we fund, both from a for-profit, but also from a non-profit point of view.
That's very good. I think if anything, I will emphasize is the for-profit is even more important in a sense.
Right. Mohammed?
Thank you. I have a question and then a suggestion after, but the question first, have you considered, like when I hear what everything is being said and the purpose of this program, have you considered, instead of using a warrant for that portion, actually applying your loan program? So basically you have, the 4 million, so you will fund the 3.2 as you normally would, and then the 800,000, you apply your loan program, and the company right up front, right then, they take a loan of $800,000 under the terms of your current loan program. Sham?
Yes, we did. So we considered that. And the reason that we chose to go with a warrant-based co-funding option was that it would keep it simpler, both from our perspective as well as from the company's perspective, where they're getting a single award and not having to have a loan terms plus the award terms on top of that, as well as the fact that, in terms of how they're carrying that in their books, they would have a loan as well as the warrant on top of that. So we thought it would just be cleaner to keep it as an award with the warrant coverage for their amount that they're getting in addition to what they would get previously. So, but that is something we did consider.
Yeah. So, Sham, I'm not sure if I would agree 100% with this, making it simpler. They will still end up with two instruments. They will end up with the funding and they will end up with the warrant. And these are two aspects. So I don't think that saves. I think you should really consider that practically, and that could simplify the situation and achieve your goal. Now, the suggestion that I have, if we go with the warrant route, and the comment that was discussed earlier, and I commented on it, which is their ability to cancel it at a time when we actually want to cash out on the warrant. And perhaps if they choose to cancel it, then at that point in time, say, you have the option to cancel, but at that time, it will be handled as a loan from the beginning to that point of cancellation, and interest will accrue at the time of cancellation. At least that could offset that idea of, okay, free money for the time I wanted it, and now I'm cashing out.
Yeah, and that would be part of what we would be developing, and that's what the current loan program is. So the committee has raised excellent points with respect to that cancellation period after the award is ended and how long that tail is, because as you said, likely the incentive is to to cancel the warrants right before a major financing event that would then prevent us from realizing the return on that. In order to cancel it, if we were following our current loan conversion principles, it would be the principal amount plus premium on top of that, right? So that would be there, and it would have to be significant for it to make sense for CERN to take that risk. And I just want to, while I have the floor, just want to acknowledge, thank you, Steve, for clarifying on the business plan. So I was misinterpreting it as a business plan of, the company. With respect to the financial due diligence, I just want to note that while, right now we're doing financial due diligence in the company in terms of solvency and co-funding when they apply. And then over the course of the award, grants management does do co-funding checks. So they do a financial review of the ability of the awardee to put up the cash-based co-funding amount. So in this particular example, if in the warrant-based option, if it was important to this committee and to the ICOC and as well as to CERM that we maintain that check along the way to see if the company is progressing or maybe even has raised additional funding to keep going forward, that's something we could build into that mechanism.
Great. All right, well, let's come to the question. And so what the last slide that Sean showed was one about whether or not we want to proceed with this concept of developing a warrant-based alternative to co-funding. And if so, then we would work the details out in with more definition, and then basically have a joint meeting between this committee and the science subcommittee, which is where essentially the whole notion of co-funding was initially generated, is at the science subcommittee side of this. So this would be our recommendation to the science subcommittee to change the current mechanism we have. But so the question is whether we want to continue to pursue this, or whether at this point we think, well, let's just stick with what we have and just require co-funding. So that's why I think the question that we have. So I see Larry has raised his hand, but I want to get a sense before we end this call of whether this is worth pursuing or not, because we've already spent a considerable amount of time dealing with this, Barry and Sham and myself and some others at CERN. Larry, you have a question or comment?
Well, I just want to remind us that in part, Prop 71 and Prop 14 were justified to the voters of the state of California based in part on projected economic returns. And of course, there's always the question of, well, do we just say that if the state, if companies get started in the state, then of course the state benefits economically, at least the people do. But do we also want to try to live up to the notion that there may be direct economic benefits? And in the case of CERM, by return of value to CERM, which is then used to finance additional grant projects in the future. Perhaps this is part of thinking about sustainability.
Well, yeah, as I said earlier on, I mean, I think all in, and Ben mentioned this, but right now, the way our regulations are written for the projects that have been funded now for some period of time, should there be a commercial success associated with any of them, and those products get sold, no matter where they're sold, we get a royalty. I don't exactly remember the amount, and Ben can remind me, but we do have an economic stake already in whether these things originated in academia or in for-profit companies or whatever. I think this is more, as much as anything, about trying to help young companies that are not necessarily having great financial wherewithal as they're just getting started, and where every dollar counts a lot, and trying to help them move forward, but at the same time providing some economic potential upside for CERM. So that for me is kind of the gist of it. I think this is what Maria was referring to earlier, is we have what we're seeing is we're missing some opportunities to provide funding for what might be attractive scientific projects simply because the companies don't have the economic wherewithal to put up the co-funding amount. And so they're, we're not able to help them out. And I think that's kind of the mainstay of what this proposal is about.
Steve,
Yeah.
I'd like to answer your question, which is, you're trying to see if the committee would support continuing on this path or not. So I want to answer it from my point of view, because it's not just a yes or no. I think there is a yes, but we need to make sure that the elements of our conversation are being addressed in the next steps, in my opinion, including what Larry was saying. Yes, we want to maximize our opportunity for having our revenue share. But there is a point also, we need to think about how we will prevent, as we launch this, how we will prevent everybody getting on the bandwagon and going with this route as opposed to the cash route. So there will have to be some qualification criteria for the companies that will be accepted in the warrant program versus, their cash in the program. And think of it also as an equity point, like does everybody, have the option to get free money until they get their money in? So again, the terms of the cashing out and all that. So my personal answer to your question, Steve, I like the direction. I still see a number of adjustments to be done to it before we consider it ready, but it is encouraging.
All right. Well, what I hear from you, Mohammed, and what I've heard from others is that we need a little more fleshing out of a proposal. And I think one of the concerns has been that somebody could walk away from a warrant essentially, and we wouldn't receive much return from it. And the suggestion was, much like we had with the loan program, is that you have to repay the money, but then there's also a premium to be repaid as well. So that's something that we need to think about. So, Sham, I think before, and I'm going to presume this is where we are, that before we decide to try to get together with the science subcommittee, that we do a little more fleshing out of the specifics of what we intend here. Come back to this subcommittee one more time with the concrete proposal of how this would work, and see if we can get endorsement from this subcommittee, and then we can go to the science subcommittee. I think we're still mulling this over, so to speak. Does anybody have a different idea about this?
No, you summed it up so well, Steve. Thank you.
Okay, so I think this has been a great discussion. I appreciate all the people who have weighed in. I think we now have a little bit better sense of what we need to do, and we'll go back to the drawing board and work a little bit harder on this. But what I don't get a sense of is that people think this is just a stupid idea. To be clear, that people will say this is just dumb. Let's not do warrants. We'll just require them to put up co-funding. I think people, generally speaking, are okay with it as long as it's done in a thoughtful manner that really creates the opportunity for reward to CERM out of all of this. And along with that, the companies have the wherewithal to do the project. That is, they have a business plan that's sustainable, so that there's not just the idea that they ride on CERM's money and don't have any other financial means to deal with the running the company. Is that a fair assessment?
Yeah, I think it absolutely is. And I think there have been some really good suggestions and questions raised here that will just make the proposed program that much stronger. So I would agree that go back and Sham can synthesize all this and integrate into the next draft of this to come back for the discussion. I do want to highlight Larry's last comment, which is there is embedded in the propositions the notion that it's completely fine for CERM to get some sort of a return within the bounds of the regs, et cetera, that can help us put money out for additional programs, and that this is one of the ways we can do it. We can't hold equity, that's not permitted, but this is something that is allowable, and I do think that it's a good mechanism towards that end, and something we should be thinking about as a means of increasing the amount of funding we have at our disposal to fund even more than we can already. So I think everybody's suggestions and questions were great. I think it's been a really, really good discussion. And Sean, thank you very much. You put a ton of time into this already, and it shows from the quality of the presentation. And so thank you. But I think we'll get, as a result of this, an even better product in the next go around. Thank you.
Yeah, let me just echo what JT just said about all the work that Sean has put in on this, because I've been at his elbow while he's been doing all this, so it's a lot of effort that's been involved. So unless somebody feels strongly otherwise, I think that's what we'll do. We'll put a little more work into this, come back with a more detailed proposal to come back to this committee with, and then assuming that it meets with the muster here, then we can propose a meeting with the science subcommittee, but we may be a little later on into the next year before that happens. Agreed?
Yeah.
Yes.
Anybody?
Yes.
Agreed.
Yeah.
Okay, great.
Good work, guys.
Thank you.
All right. Well, thanks, everybody. Thanks for participating. It's been a very good session.
Steve, if I may, just one quick thing. It's hard to be in a SURM/ICOC meeting without mentioning the email that I'm assuming many of us received from JT this morning.
Right.
And the shock wave that it has caused to, I'm sure, many of us. I don't know, JT, if you want to mention just one word about it. I'm sure there will be a tribute to.
Yes. So as I indicated to you in email early this morning, we had terrible news yesterday that our colleague Kevin McCormick has tragically passed away from a heart attack on Sunday evening, and it's really unfathomable. I know everybody on the board has worked with Kevin in one capacity or another, and he's been someone who's been an integral part of the organization in overseeing communications and working with Maria B. on public patient outreach, and has been the voice of CERM to the outside world in so many different ways, and done it with the most charming personality, and I think, Anne-Marie, you said kindness and tailoring comments to the audience that were directly on point and personal, and made everybody feel like he and CERM by connection was very concerned about their particular case and was doing everything he and we can to try to help things. He was just a wonderful person, and it's just a huge shock to the organization, and we're in the process of sort of figuring out where we go from here, which Maria B. is leading that effort. As I said in the email, Dr. Milan is reached out for grief counseling to make that available to the CERM team. It's a huge and terrible shock, and we will, I think this is happening in real time. Everybody's trying to digest this and adjust, and we'll have a proper testimonial to Kevin, I think, at our January board meeting, when we've had time to put together something that is deserving of his enormous stature in the organization. So it's very, very tough for all of us to deal with. And I will call upon members of the board at that January meeting to say some words about Kevin. So those who are on, please anticipate that. Anne-Marie, thank you very much for mentioning it.
No, exactly. Yes. Thank you, Anne-Marie. Absolutely. All right. Well, with that sad note, I think we'll call this meeting to an end. So thank you all for participating. Thank you for all your comments and helpful suggestions, and we'll come back to it again.
All right.
Have a great
Thank you,
day.
Steve.
Thank you, everyone.
Thank you.